The following is brought to you by CHI St. Vincent.
Well, CHI St. Vincent joins us today. They are in the process of building a new oncology program to better treat and care for cancer patients here in Central Arkansas. And part of that includes a program with the recent expansion of the Infusion Center at the infirmary here in Little Rock. Dr. Peter Emanuel joins us today. He joined St. Vincent last fall, and we've got some wonderful things going on there. Welcome to the show.
Thank you.
Yeah.
Thank you.
Talk about the new expansion and what this is going to mean.
So, you know, nowadays to cancer patients, the infusion clinic is most everything for them. That's where they spend the vast majority of their time, because cancer care has shifted from the hospital setting to the outpatient setting in the last 20 years. And so the infusion clinic is where they spend the bulk of their time, and they want their family members to be there. They want to interact with other patients, compare notes, and everything. And so a welcoming infusion center is a big deal. It becomes a family, really, I think, with their caretakers, with the other patients. With the infusion nurses and everything. And so just in the last couple of months, we've doubled the capacity of our infusion clinics at the infirmary. And with Little Rock Diagnostic Clinic joining CHI St. Vincent recently, they have an infusion clinic to treat the non-cancer patients. So it really adds to our capacity to be welcome for patients to the infusion clinics.
Absolutely. That's wonderful news. Now, you specialize in leukemia and other blood cancers.
Blood cancers.
What's it going to mean for those patients?
Again, while we still have to treat some acute leukemia patients in the hospital with chemotherapy, many of the regimens now are in the infusion clinic. There are many new drugs for the blood cancers. The FDA has approved 40 new drugs for blood cancers just in the last 2 years. And so many of these are given as IVs in the infusion clinics. But the outlook for leukemia is much better just in the last 5 years. That is great news. So talk about some of the new treatments. So you mentioned several new drugs that we have on the market now that can treat them. So there are many forms of leukemia, but chronic myeloid leukemia is kind of the poster child for all of cancer, in that 20 years ago, that was the first targeted therapy for any kind of cancer. In the last 10 to 20 years, we've developed targeted drugs for many of the blood cancers. And so we're getting away from chemotherapy and using more immune therapies and signal transduction therapies. They're much more effective, and they're much less toxic. To all the side effects we see from chemotherapy, perhaps they don't have to see those. And where do you see this going in the future for patients? More and more treatment options? Yeah, so I think there'll be more and more cures, but to get to those cures, we're going to have to start combining some of these newer therapies. Right now, we're using them by themselves just because they're so new. As we get to learn more about them, we'll start combining them. Then I think the cure rate for a lot of the leukemias and lymphomas will really start to escalate. What are you hearing from some of your patients, both about the new center they get to go to, and then, you know, the fact that there's more hope out there, I think? So they love our new infusion clinics, that they're open and airy and daylight and everything. But they're also very optimistic about all these new therapies. Of course, there are challenges to get them approved and affordable and things, but they're very optimistic about their future as a cancer patient. So good to know that CHI is on the cutting edge of that, so that we can get the newest treatments for patients here. We look forward to it. Thank you so much for coming in and telling us about it. We want to keep you always up to date on CHI St. Vincent and all the treatment options and plans that they have there to keep everybody healthy. Here's the information on your screen. If you need to check it out, the best way is to go to the website right there. If you know someone in your family that perhaps could benefit from these treatment options, be sure and do that. They're also on Facebook and Twitter and all those places too. Thank you, Doctor, for being here.